signs and symptoms and associated conditions. We're going to talk about those in this lesson, but before we begin, let's talk briefly about what type 2 diabetes is. Type 2 diabetes is a condition involving impaired glucose regulation. So the impaired glucose regulation is a result of decreased insulin sensitivity or insulin resistance, which leads to decreased glucose tolerance and increased glucose levels. The risk factors for getting type 2 diabetes include having metabolic syndrome and being overweight or obese. There are genetic predispositions for getting type 2 diabetes. So if you have a family history, for instance, if your parents have type 2 diabetes, you're more likely to get it yourself. And then certain ethnic groups are at an increased risk for getting type 2 diabetes as well. And then being on certain medications can also increase your risk for getting type 2 diabetes, and these include some antipsychotic medications. Now, the epidemiology of type 2 diabetes reveals that it is a very, very common condition. 8 to 9% of the world population has diabetes. And out of this portion of people who have it, 90% of cases of diabetes is type 2 diabetes mellitus. So the other 10% would be type 1 diabetes. So the topic of this lesson is type 2 diabetes causes certain signs and symptoms and associated conditions. So it all has to do with increased glucose levels affecting certain organ systems. We're going to talk about each of those in the next upcoming slides. It's first important to note that many patients may initially have no symptoms at all. So there is a period of time when patients may be asymptomatic. But if patients do have symptoms, some of them include the following. Polyuria is one of them. So polyuria is increased urination. Poly meaning a lot and urea referring to urination. So urinating more often or an increased frequency of urination and increased urine volume. So this can be different from other conditions that might cause you to urinate more often but have a low urine volume. Polyuria causes increased frequency of urination but also having increased urine volume. So this can lead to dehydration in some cases. Now, the reason polyuria occurs is because normally glucose is reabsorbed by the kidneys. However, if levels of glucose are too high, the kidneys will not be able to reabsorb all of that glucose. So glucose enters into the urine and then water follows that glucose. So water essentially acts as a sponge and sucks up water to bring with it. So that's why we see increased urination or increased urine production in these patients. Now, another related symptom of type 2 diabetes is polydipsia. So polydipsia means increased drinking. So polydipsia often presents with feeling very thirsty a significant amount of time. So the reason this occurs is because of increased urine losses. So because of all those increased urine losses from polyuria, patient feels dehydrated. They feel like they need to drink a lot more fluids. So this is the reason why we can see polydipsia along with polyuria. Now, another symptom that can occur in type 2 diabetes is polyphagia. So polyphagia is increased consumption of food. So this is due to decreased insulin sensitivity. So when there's decreased insulin sensitivity or insulin resistance, insulin-sensitive cells are not able to access or get that glucose. They're not able to use that glucose for energy production. So it makes those cells and parts of the body feel more hungry. So it leads to increased hunger. So we can see polyphagia also occurring in type 2 diabetes. And an easy way to remember those three symptoms is the 3 Ps: polyuria, polydipsia, and polyphagia. Now, another very important symptom to recognize in patients with type 2 diabetes is fatigue. So feeling tired and having low energy may be a common symptom of diabetes. So I mentioned that a lot of patients may be asymptomatic, but they may also have some vague symptoms that they don't really recognize. They may feel more tired than usual. And the reason fatigue occurs is believed to be due to increased glucose levels and decreased insulin sensitivity as well. Now, another sign of type 2 diabetes is weight loss. So weight loss or losing weight may occur in patients with type 2 diabetes. So this might seem counterintuitive. If a patient is overweight or obese and they have diabetes, why are they losing weight? Well, the reason is because proper insulin functioning is required for fat and lipid formation. So because there's insulin insensitivity or insulin resistance, the body's not able to react to that insulin to turn on certain cell signaling pathways to make lipids or to make fat. So this is one of the reasons why weight loss can occur in some patients with type 2 diabetes. And this is why some patients who are diabetic, once they start taking insulin, they can actually gain weight. So this can be a reason why. So again, because of that decreased insulin sensitivity and decreased levels of insulin, which can occur in type 2 diabetes as well, this can lead to reduced fat formation. Now, another very important symptom of type 2 diabetes is vision changes. So vision changes can occur, and one of these is blurry vision. So blurry vision can occur due to increased glucose levels, which cause osmosis and swelling of the lens of the eye. So the lens of the eye can be swelled due to this increased osmosis from increased glucose levels. And then there's this other condition that can occur in uncontrolled or poorly controlled diabetes, which is known as diabetic retinopathy. We're going to talk a bit more about this a little later on, but this can also present with vision changes. And one of those vision changes is vision loss. And so diabetic retinopathy, very important to recognize. Diabetic patients can also be at an increased risk for infections. So we may see increased infections in type 2 diabetic patients. The reason is because diabetes inhibits immune cell functioning. So certain immune cells and their functioning become impaired. So this is the reason why. So the patient can be at increased risk for any type of infection, but some more particularly include respiratory tract infections and fungal and yeast infections, like oral and vaginal yeast. So these are two more common infections that can occur in diabetic patients. So if you see a patient with fungal or yeast infections more often, or some infection that doesn't want to clear up or resolve, this might be an indication that the patient has type 2 diabetes. And the reason why some yeast infections are more likely to occur in type 2 diabetes is because Candida albicans, which is the yeast that causes yeast infections, proliferates when exposed to higher levels of glucose. So when they're in an environment that they have access to higher levels of glucose, they respond by growing more and more. So this is a reason why we can see yeast infections being more commonly found in patients with type 2 diabetes. Now, another important symptom of type 2 diabetes is paresthesias. So what are paresthesias? Paresthesias are numbness and tingling sensation in the extremities. So oftentimes it's going to start in the nerves farthest away from the core, which are going to be nerves in the feet. So those are going to be the first ones to be affected. So it's important to check patients' feet. And this is due to peripheral neuropathy, which we call diabetic neuropathy. So high levels of glucose damages neurons, especially high levels over long periods of time. So this is going to lead to damage, first starting with nerves that are farthest away from the central nervous system, so nerves in the tips of the toes and the feet, and this can progress into areas closer to the trunk, and we can see some associated conditions occurring. We're going to talk a bit more about that later on in this lesson. Another important finding in type 2 diabetic patients is delayed wound healing. So wound healing is impaired in diabetic patients due to poor circulation that may develop during diabetes disease progression. So the circulation, especially in places farthest away from the heart, is going to be affected first. So that's going to include the toes and the feet. So we're going to see that if there's any wounds in the toes or the feet, they're going to be more difficult to heal because there's going to be poor blood flow to those areas. And along with the peripheral neuropathy or the diabetic neuropathy we talked about before, this is going to lead to increased foot injuries, and then also on top of that, increased issues with wound healing. So both of these combined are going to cause patients a lot of issues. Now, there are three main conditions that can occur with type 2 diabetes, especially in poorly controlled type 2 diabetic patients that have type 2 diabetes for long periods of time. We alluded to these before. One of these is diabetic retinopathy. So this presents with vision loss, blindness, and it can also increase the risk for getting cataracts later on in life and increase the risk for getting glaucoma. So because the eye and some of the arteries and vasculature in the eye get exposed to high levels of glucose for long periods of time, it can lead to damage to those vessels. And this can be a reason why we see diabetic retinopathy occurring in type 2 diabetes. Another important condition that can occur with poorly controlled diabetes for long periods of time is diabetic nephropathy. So diabetic nephropathy is kidney disease caused by diabetes. So the small vasculature in the kidneys can be damaged and affected by diabetes and high levels of glucose. And this can ultimately lead to kidney damage and chronic kidney disease in patients. So we can see signs and symptoms of chronic kidney disease in some patients. And if you want more information on those signs and symptoms, please check out my full lesson on the signs and symptoms of kidney disease. But some of them are going to include changes in urine volumes. So there might be some decreased production of urine, especially in some severe cases of chronic kidney disease. There might also be some itching or nausea due to uremia. So we're going to see a multitude of signs and symptoms that can occur in patients with kidney disease. So again, if you want more information, please check out my lesson on that topic. And then the other condition is diabetic neuropathy. And we, again, talked about this before. And some of the clinical findings from diabetic neuropathy are going to be those paresthesias we talked about before. Numbness and tingling sensation in extremities, especially starting in the feet and the toes, and then working their way up to neurons closer to the central nervous system. And this is going to lead into the next slide on associated conditions. Now, there is a long list of medical conditions that are associated with type 2 diabetes. We're not going to talk about all of them, but we're going to mention some of them here. So some of them include gastroparesis. Now, this connects with the peripheral neuropathy. So if the patient has long-standing diabetic neuropathy, this can cause neurons closer to the trunk to be affected as well. And one of those is the vagus nerve. The vagus nerve innervates and is responsible for the functioning of the stomach. So when there is neuropathy of that particular nerve, the vagus nerve, we can see gastroparesis, and this can cause symptoms like nausea and vomiting. So in patients with gastroparesis, if it's due to diabetes, they're also going to have diabetic neuropathy as well. So they're going to have issues with paresthesias in their feet. So the nerves in their feet are going to be affected first, and then later on, they're going to have issues with nerve damage in the vagus nerve later on in their disease progression. We can also see diabetes patients at an increased risk for coronary artery disease. There are macrovascular changes that can occur, and this can increase risk for getting coronary artery disease. We can also see patients at an increased risk for stroke. Patients who are insulin insensitive or have insulin resistance are more likely to have acanthosis nigricans, which is this darkened, velvety, textured skin in certain parts of the body, including under the armpits. Patients with type 2 diabetes are at an increased risk for getting dementia later on in their life. And then another related condition that can occur in type 2 diabetes patients is hearing impairment. So these are just a handful of associated conditions that are more likely to occur in type 2 diabetes patients, but there are many others as well. So if you want to learn more about type 2 diabetes, including the pathophysiology, how it's diagnosed and treated, please check out my full lesson on this topic. And if you haven't already, please like and subscribe for more lessons like this one. Thanks so much for watching, and I hope to see you next time.